kinds of expert opinion, like Donald Berwick, who's been appointed, Dr. Donald Berwick of Harvard, who's been appointed by the president to head the Center for Medicare Services, Atul Gawande of Harvard. They did a study of 90 hospitals in Michigan, where they reduced the rate 80 to 90%. It was done by a Dr. Provenos from Johns Hopkins, who conducted this study. And he wrote that when they left, when the funding for these studies ended, the hospitals backslided, and that the infection rate started going up. But there seems to be a consensus among these people, very reputable medical people, that they're overwhelmingly preventable, including MRSA.
Absolutely.
So there's something else going on here that's not right.
Well, prevention is a very important feature. When I trained as an intern and as a resident and as a fellow, one paid no emphasis to washing your hands between patients. Now, you can't go from one patient to another patient unless you wash your hands. The disinfectants are outside every room. When I wrote the book, I was astonished to find that despite the fact that doctors would often, but not always, 50% of the time, when I did the research for this book, 50% of the time, doctors washed their hands in going from patient to patient. It was subsequently discovered that even when they washed their hands, staph organisms existed on their pens, so that just writing a note with washed hands would easily spread the infection. And remember, when you're a patient and you've had general anesthesia, your immune system is the lowest it's going to be. You're susceptible to everything. Many hospitals, but not all hospitals, use isolation procedures. There were very few isolation procedures when I was an intern and a medical student.
Right.
So I think we're getting better, but so are the bugs. The bugs are getting stronger, and we're realizing how easy it is to spread bugs from a doctor particularly to a patient. I mean, one little observation of mine is that when you see someone in the street wearing hospital greens, we better hope that he's not wearing those greens back into the OR. And that happens all the time. Surgeons walk around with their wardrobe, at least in the daytime, consists of hospital greens. They make rounds in hospital greens, and unfortunately they go home in hospital greens. And they have often contact with children, their kids, other kids, coughing, spitting, vomiting, come back to the hospital with the same hospital greens. So sterility, prevention by washing your hands, prevention by you have to wash your hands between each patient. As I said to you, 50% of doctors don't do that. And I'm not even talking about the hospital setting. I'm talking about the office setting. If you see a doctor and that doctor has not washed his hands after the previous patient, get another doctor.
Well, I saw a movie as a kid in which there was a Dr. Semmelweis, an Austrian or Hungarian, who was a huge hero in 1850, 1860.
That's right.
Because he discovered why mothers were dying in childbirth, and the reason was doctors weren't washing their hands. Now, you're telling me that 150 years later, doctors are still not washing their hands.
Actually, with Semmelweis, it's very interesting that you mentioned Semmelweis. Prior to Semmelweis was an obstetrician. Prior to Semmelweis, it was prestigious for doctors to go around from patient to patient with a stained apron. The stains were from the previous delivery. The more stained it was, the better the doctor was thought to be. Semmelweis said, wash your hands, and people thought Semmelweis was crazy.
They destroyed him.
Exactly. Now, certainly we're far ahead of the times in Semmelweis, and we recognize the fact that that dirty gown that he wore, which festered infection, was causing, it was called puerperal sepsis. That means infection of the pregnant woman. When, again, we have to emphasize, Semmelweis said this 100 years ago.
Oliver Wendell Holmes also, right?
Precisely. Yes, Oliver Wendell Holmes. Now, it certainly is being done. I mean, it certainly is being done to a greater extent than it ever was years and years ago, but still not enough. Doctors still go around with pens that are infected. My daughter had a neurosurgical procedure at a very prominent hospital, and the doctor, after the neurosurgical procedure was completed, remember, she had her brain opened. I mean, she had an incision. She had a direct track to her brain. The doctor came in with a face mask and was coughing. And when my wife said, "You have an infection, I don't want you to," the doctor said, "That's all right, I'm wearing a face mask." So doctors don't realize this. Certainly patients don't realize it. The emphasis on sterility must be made. We have to catch up with the bugs because the bugs are eventually going to get us all.
Well, I read, this is in the University of California medical newsletter, and I think it would be reliable. One doctor said we could almost make Medicare solvent if we did what we're capable of doing in stopping infections. Medicare pays out a huge amount of money, Medicare and Medicaid. I even was billed for the treatment, when I was at Stony Brook, right, and I caught the infection and then the C. difficile illness. I was billed for treatment of infections I caught in the hospital.
Exactly.
And there have been attempts for Medicare to have Medicare stop paying for infections like infected catheters and pneumonia from ventilators and things like that. But why are they still doing this? And why are the hospitals with bad records, and I've looked at the New York State data,
right,
and there are hospitals with bad records, why are they still being paid by Medicare? Why don't they do what Lyndon Johnson did when he wanted the hospitals to be integrated in the South and saying you clean up your act or you don't get the money and you don't get to bill the patients? And I bet that would end infections or cut them very soon.
Well,
but the Joint Commission certifies hospitals, and the Joint Commission seems to me to have a deep conflict of interest because like Dun & Bradstreet and the bond raiders, Dun & Bradstreet being paid by Lehman Brothers, the Joint Commission is being paid by the hospitals that they're saying they're certifying as being safe. So it seems an entirely corrupt situation to me.
It is an entirely corrupt situation. It's being addressed only recently by the Obama administration, and it's being addressed not only in the ways that you've discussed, but in other ways as well, with something called quality control. Electronic records can tell everybody, particularly Medicare, who's doing what to whom, why, and how good they're doing it. It's very important that quality control be put into medicine. If quality control is put into medicine and you develop your C. difficile infection in the hospital and that doctor or that hospital or that room has got so many C. difficiles, then indeed, when you don't pay them, they'll listen, all right? They shouldn't be paid.
Yeah, pay them in the pocketbook.
Exactly.
And it's so inexpensive to control it, according to
it's
simple checklist.
Yes. I agree 100% with you. Quality control, if you pay physicians more for better performance, and this is what Obama is trying to do, and don't pay physicians for poor performance, wait and see how often and how much medicine will improve.
Well, it seems I think this is all a step in the right direction.
Yes.
Just like the publications for the general public of the infection rates in New York State. I mean, for example, I know if I need an orthopedic surgery done, I'm not going to Lenox Hill, I'm going to the hospital for special surgery. And that's from the New York State figures.
Right.